Mr. Chairman. I hope we can stay on topic about talking about chronic disease, but since we veered off, I just want to bring up a few things. Mr. Connell, I think your comments about consolidation were spot on. The absolute destruction of the healthcare system has been, I believe, primarily driven by the consolidation in the last decade, primarily. But you went off the rails when you started talking about the premium tax credit. So let me bring some facts back to you. The ACA was written by insurance companies for insurance companies. If you look at their profits since 2014, up, 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 up. And what we've done as a federal government is ensure that insurance company profits have been sustained. When the CR came out of the Senate, and it didn't have anything about the continued of the enhanced temporary premium tax credits, guess what? Pull the top 4 insurance companies, look at what their stock prices did. They went down. They went down. These are just facts. These are just facts. So these were temporary. And let me ask you a question here, because I think facts matter. You're talking about gloom and doom. People are going to, crash and burn. How much prior to the enhanced premium tax credits did someone who was at 100% poverty level pay per year for Obamacare? Do you know that by any chance?
I don't have that number on me, no.
So someone who made $15,000, or let's say a family of 4, paid about $400 for their health care. So with the enhanced premium tax credits, it went to 0. So we're asking them to pay a little bit of money for their health care. That's not going to put them in the, good Lord, look at what happened in the inflationary period during the Biden administration. That is what put people as far as not being able to afford things. And as far as this nonsense about vacations to Bali and everything, I wish we'd stop that hyperbole. Nobody's doing that. Nobody's doing that. If you believe, and let me ask you this, do you believe that patients should have a choice in their health care, or should that we as a federal government tell them what to do with their health care? That's what HSAs are about. They give patients choices. That's what they do. And so nobody's getting rich on these things. My premiums have gone up 100% because I'm on the exchange, because I have to be as a member of Congress, have gone up 100% in 4 years. The issue and the problems is that this city, this government has been feeding an insurance industry with its insatiable appetite for more and more and more. So we fund the enhanced premium tax just credit from before. You have 6 million people who never filed a claim, maybe up to 12 million people who've never filed a claim. They don't even know they're on this plan. Guess what? Checks go directly from the federal government into United's pocket. That's what happens. Look, we need efficiency. We need accountability. Good Lord, I've been taking care of poor people for 35 years. I want them to get care. But you know what? A little skin in the game is never a bad thing. And the fact that insurance companies have become rich off Obamacare is anathema to what we should be doing about health care. Dr. Hoban, let's talk medicine here for a second, because we're going to talk about chronic disease. What do you think is the biggest driver of chronic disease in the country? If you had to say one thing, what makes the American, if you compare us to Britain or Italy or France, what drives us more into chronic disease than anything else?
So I appreciate the question. As you know, there are lots of things that drive it, but one of the largest is, in my opinion, lifestyle choices and access to healthy food, access and time to exercise, and things that drive those healthy behaviors, and lack of incentives around those.
So what is the federal government's role in trying to change that? I would submit this is a hard question, because people have choices. I live in eastern North Carolina. There's fast food everywhere. There are food deserts everywhere. People don't have much choice. But I believe 100% that a lot of chronic disease in this country, a lot of it's genetics, especially in minority populations, higher rate of end-stage renal disease, cardiac disease, diabetes, obesity, et cetera, et cetera. A lot has to do with genetics, but a lot has to do with choices. I wish I knew how to put the genie back in the bottle. We look at ultra-processed foods, and the MAHA movement is spot on about how we are poisoning our body. Look, I love me a Cheddar Bow biscuit every once a year, and everybody does. But I think we are driving this issue, and I don't know how, and I've really thought very, very hard about this, how we put that genie back in the bottle other than through education. Ms. Reichert, if I can ask just a quick question here first. There are a lot of good models about how pharmacists work together with doctors. How am I going to prevent somebody when you have TV commercials that said, got COVID need Paxlovid, for pharmacists to just give everybody Paxlovid, especially if they're employed. I'll go back to a little vertical integration here by PBMs and insurance companies. Just answer it real quick, if you will.
Yes, thank you. Well, I believe that, pharmacists are medication experts. And so by allowing pharmacists to test to treat, we would only treat a patient if it were appropriate. I don't believe, we're just going to be out handing out packs.
I don't think so either.
Yeah.
I really don't. I love our pharmacists, have wonderful relationships with them. I do worry about, in the world of vertical integration, about perverse incentives from insurance companies that own pharmacies, et cetera, that this would happen. So thank you, Mr. Chairman. I'll yield back.
Thank you. Mr. Thompson, you're recognized.
Thank you, Mr. Chairman. I want to thank all the witnesses for being here today. Care coordination throughout our healthcare system is essential to ensuring patients the best outcomes possible. But we can't discuss care coordination if patients can't get the insurance they need in order to see a doctor.